pleasure of co-chairing the early onset GI session. And the reason we decided to focus on that is obviously because it's a growing problem. And my lecture was specifically on the epidemiology of early onset GI cancers. I really wanted to focus on the growing problem, not only in the United States, but globally. Significant concern for many of us because we are seeing patients in our clinic that are younger than the new screening age at 45 years for a colonoscopy. And as a result, we're seeing a lot of patients in later stages of disease. So really the whole point of the discussion is really to bring increased recognition and awareness regarding early onset GI cancers. I did focus a little bit on the growing rise in gastric and pancreatic cancer as well, because my other colleagues were speaking on pancreatic cancer and the biology of colorectal cancer. I did not focus on that. But in short, we don't know the exact etiology for why this is happening. We know that there are some potential risk factors such as obesity, hypertension, hyperlipidemia, alcohol use, tobacco use, but there's nothing that specifically we can pinpoint to account for why this is happening. And so really we just want everyone to recognize the signs and symptoms of early onset colorectal cancer, which is similar to colorectal cancer of average age onset with change in bowel habits and bleeding, anemia, etc. But really recognizing it is a growing problem and the individual that may be in front of you is not an unhealthy looking person. It's a very healthy appearing young individual that in fact may have colon cancer. You may not be aware of it. So if there are any potential symptoms that are unresolved, please refer your patient for a screening test. There is some discussion about whether or not we should reduce the screening age further from 45 to maybe 40 or even younger. At this time, we don't have enough evidence, but the reality is that it's approximately 49 new cases of colorectal cancer being diagnosed per day, and it'll be the leading cause of cancer death by 2030 for those less than 50 years of age. And I'm really, once again, just talking about colorectal cancer because that's where the majority of literature lies at this time, but you should be aware of it, that it is a growing issue in gastric, pancreatic, appendiceal carcinoma, and intrahepatic cholangiocarcinoma. Those are more rare cancers, or rare cancers, I apologize. But obviously, it's just increased recognition and awareness, hopefully to save a life.